We have just passed our fourth emergency assistance bill late last week on Friday, or more accurately Thursday, and that was a supplementation really of the CARES Act to the tune of close to $500 billion more in emergency assistance to our country. The supplementation bill that we just passed really had three targets. The first target was to supplement the small business assistance that had been administered through the Small Business Administration, the so-called PPP program, Paycheck Protection Program, as well as the Economic Injury Disaster Loan Program, the EIDL program. We supplemented those by an additional $300 billion. We also sent another $75 billion to our hospital and healthcare providers and added another $25 billion for use by states, counties, and medical providers in accelerating testing. Not only current testing kits, but really contact tracing related testing, surveillance testing, which we are already doing here in Hawaii. So those are four major bills that we've passed, totaling somewhere around $2.2 trillion in funding throughout our country to handle the economic and public health consequences of COVID-19. What does that all mean for Hawaii to date? I'm going to give you some very, very rough numbers. Please, these are rough numbers because it's hard to get these things down to an exact dollar figure, but these are I think we are from a Hawaii perspective. What Hawaii has received to date of those funds is somewhere north of $4 billion, perhaps closer to $4.5 billion. The state and county governments, the state of Hawaii and the city and county of Honolulu have actually received the $1.25 billion portion, of which the state received $862 million and the county received $387 million. That came in last Thursday. The state had received some monies earlier. That is for relatively discretionary use by the state and the counties. But on one major point to emphasize here, we undertook a major effort in the negotiation of this bill to loosen the flexibility that the state and counties could use this money for, primarily in the area of revenue, previously budgeted revenue shortfalls, and that was not successful. So that flexibility was not in this bill, although, as Director Suzuki will tell you, and has told you in your prior meetings, there are a number of ways in which that money can, in fact, be used for example, new positions which are not previously budgeted. We also had other dedicated funding of about $250 million. The PPP program was very well administered. The first go around here for Hawaii, we were one of the top states in the entire country for reception of those loan amounts per capita and per business. That has come in at somewhere around $2 billion for our small businesses. Not all dispersed quite yet, but it will be dispersed soon in the next week or so, I would guess. We had received somewhere around $680 million in direct payments, the economic stimulus payments, to $1,200, $2,400 to individuals and families. That was projected as of about 10 days ago, so it's probably close to $700-800 million at this point. And then there were other national areas that were funded in various tranches. We're tracking somewhere around 50 programs and trying to track them all the way through from the beginning to the end, whether it be community health centers, which received $10 million, to some of our hospitals, which received more, to our educational programs, which are going to get, for example, $43 million this week. So you add that all up, the total is somewhere around $4.5 billion. Now, what's left out there for Hawaii? We still have the prior bills, which have not been fully implemented yet in some of the very specific grants in those 50 programs or so, to about $300 million. We are starting to roll out now the federal side of the unemployment benefit. It's hard to price that one because we don't know how many people will actually apply for it at the end of the day. But we have been using, for general purposes, a figure of somewhere around $1.1 billion for Hawaii. That may well be too low, but that amount floats because the federal government has agreed to fund that depending on the unemployment numbers, not depending on a fixed amount. We still have the balance of the direct payments, which are coming to folks who were not able to take advantage of electronic payment. So those are coming by check. Those are staggered out over a number of weeks. Let's say $500–600 million still. We started this morning the second round of PPP and EIDL applications through the SBA. I will be honest, I have no idea what it's going to look like this time around. I think it's going to be a lot tougher this time around for Hawaii. We really got to the folks that had existing applications the last time, and the demand is so much greater throughout the country. People are far more prepared to submit their applications today. So I don't know how to price that one, but I priced it at somewhere around 500 million. And then miscellaneous amounts, that'll bring you to somewhere around another 2 billion, 2.1, 2.5, somewhere in that range. So we're looking in sum from the amounts funded or to be funded to date that we can say have come in, or that we can project at somewhere around $7 billion. Now, that sounds good. It is good, but it's not enough. I think we all know that. And the areas that for me are really particularly problematic, and what I see in my office and what I see in the community, and I'm sure I'm seeing the same thing as all of you, I still see tremendous needs in the area of assistance to our businesses, especially our small businesses. There will be many, many, many small businesses out there that at the end of this round of PPP EIDL funding will still not have any immediate assistance. And unfortunately, many of those small businesses are the same ones who really didn't have previous access to their lenders or had a harder time getting into the pipeline for the SBA assistance. They tend to be much more on the edge. And so I think that that's a real risk factor out there. Unemployment has obviously been an incredible issue all across the board. Virtually all of that is at the level of the state, and just simply administering an incredible demand out there. The federal acts did include monies for the states to apply to technology upgrades, and that money is available to the state of Hawaii. But unfortunately, time is of the essence, as we all know, and I doubt that those major technology upgrades can actually be funded by the federal government, can actually be implemented within the time frame that it's most needed. What lies ahead for us? We are already working on the CARES, what we call CARES 2, which is a fifth bill that we are hoping to bring to Congress sometime within the next few weeks. That's how bad the demand is across the country, and certainly in Hawaii, we have major issues. I think the areas that we're particularly focused on in CARES 2 are, again, to supplement the small business programs and hopefully improve them this time. The last time around, many bugs in the small business program, unfortunately, in the negotiations, were not fixed. The monies were just simply funded without the bugs being fixed, which is inviting all kinds of problems that we're experiencing literally today throughout our country and here in Hawaii. I think we all want to increase our amounts paid to our state and county governments and introduce the flexibility. And that could well be applied to the social safety net that the speaker spoke of. And then finally, I think we all believe that we need to again boost the amount of money that we're sending to our medical community, whether it be for administration in general and support in general, especially for some of our smaller healthcare providers across the state, especially in the more remote areas, but also for PPP, which continues to be a huge issue across the country and here in Hawaii. So that's a quick report on where things stand from my perspective on the federal level and the efforts that we are undertaking to try to get this money that has been appropriated previously and is going to be appropriated to get it to Hawaii, to the end user as fast as possible. We've enjoyed very, very good interchanges with all of the state and county governments along these lines, and so the partnership is there. I would only say, because many, many people are watching this, that again, my office is open to answer any questions, to help with any issues, and information on my efforts as well as COVID-19 overall is at case.house.gov. That's my report.
Okay, thank you.